Hi, I'm Dr. Nadir Qazi. I'm a skin restoration specialist in Newport Beach, California. I do a lot with acne, with scars, with pigmentation. I also do a lot with collagen stimulation and facial balancing. So tonight I'm going to showcase a really nice, one of my favorite results ever and one of my favorite patients, where I am showcasing how we could achieve really beautiful results, natural results with collagen stimulating products. So I'm going to showcase that for you guys, and you can just see just how over time this patient looks like just really refreshed, and it still looks like her, just a really great version of herself. And that's what she was trying to achieve. She's somebody who didn't have much fat, didn't have much volume, and so it wasn't somebody that could do something like fat transfer, for example, or anything like that. And instead, by using collagen stimulating products, like in this case, dilute Radiesse, as well as some Bellafill, we were able to really achieve a really, really nice result. So I'll wait for a few more people to come on, and I'll walk you through just how I did this, and overall just how I do how my approach is with fillers and with the aging process in general. I really don't try to get people to look, younger. I just try to get it so that at the age that they're at, they just look really, really refreshed. They just look like well rested. That's what I'm trying to achieve. I'm not trying to make it so that they, turn back the clock and look back at like they're 20 years old or so. And to be honest with you, most people don't want that anyways. Like most people aren't trying to achieve that. People just, recognize that there's some aspects where they're a little bit, they may have lost a little bit of fat, or they have some new wrinkles and fine lines. And those are things that kind of bother them when they look at themselves in the mirror. And so that's the stuff that I kind of focus on. I try to make sure that we can make it so that that is the thing that we can make patients feel happier about. You really run into a lot of problems though if you're trying to shoot for a certain look from when you're 20 years old or something like that. This is achievable, and this is achievable for pretty much any patient as long as we're on the same wavelength and we're trying to just keep it really natural. I'll be able to do that. We even did this patient's lips, for example. We did a little bit in her chin, really just full facial balancing, just like kind of throughout the whole face. Thanks, Emmy World. Nice having you on right now. Appreciate you coming on tonight. I know it's late for you over there, so thank you so much. Well, what is this that I just joined? I'm guessing Sculptra. So this is actually with dilute Radiesse and Bellafill, but Sculptra is excellent as well. In this case, for this patient, she had a little bit of laxity. Her skin was a little bit loose. So I opted more for Radiesse because I wanted to get a more elastin stimulation. So elastin is actually really, really valuable. I know I talk a lot about collagen stimulation, but elastin is really useful for the skin tightening effect. So it's useful in the face. It's also useful in the neck. And that's what I wanted to get it so that we can basically feel like the skin feels a little bit more firm. And we were able to get that for this patient. And she's super happy with that. She's somebody who years later, I haven't really even touched actually again with any filler. She just comes in for some Botox and a little bit of laser for some pigmentation. But other than that, actually, she's very happy with where she's at, and she doesn't feel like she needs to do too much more, which is awesome. So it's it's rewarding because this is the kind of thing that like over time gets better and better, which is really cool too. Sometimes we do see an effect right away, but like a year later, 2 years later, 3 years later, you still see that the skin quality is really nice. Their skin has like this bit of a glow to it, which is really cool. So there's like these added benefits really with this, especially with collagen stimulating products. And that's why I really emphasize collagen stimulating products. And in this case, this is collagen and elastin stimulation, because you want something that's going to make the skin quality better and then also make it so for some patients a little bit tighter, more firm. So again, really useful also in like the neck area. So for patients where they feel like they have tech neck, I've been trying to make sure that I don't look at my phone as much just during the day because I'm worried about that myself. And just in general, I just felt like It's just bad for my posture and things. And so like, it's just terrible, honestly, when you look at it. It's like everybody's just bent over there, and we're looking at our phones. So it'll be nice if we have a system where we don't have to do that, maybe with like glasses or something like that. But like in the meantime, we definitely need to do something for patients who have kind of over time have been doing that process and been stretching their skin and causing more wrinkles there. And that could be something with dilute Radiesse. So the same product over here, which is a calcium-based product. So a lot of people always ask, like, what are the natural products that we could use? Calcium, like, you don't get more natural than calcium. So calcium product, it goes in the system, and you absorb it really fully. And that's all it really is. It's just a calcium-based product. And I use that not just for anti-aging purposes. I also use it for scar patients. Some of my scar results as well, they're with patients that I've done Radiesse with as well. What would be the treatment for tech neck? So yeah, exactly this. Dilute Radiesse is awesome for tech neck. I actually prefer that for sure for the neck. And it's going to be better than something like Sculptra, because Sculptra in the neck area could cause nodules actually. Even like a dilute form of it, it's just like a very mobile area with the neck. And so you don't want to do something that could trigger collagen in one localized spot like that with Sculptra. So you could run into more problems with that. But I do love something like Radiesse, because you could just really spread it out, and then it's a calcium-based product. So it's not going to be there forever. So that's also really nice, because you don't really want like a permanent product in there that you could run into problems with, where it's a little bit stiff for you in the neck area. I have flat cheekbones. How should I do Radiesse, Sculptra, or cheek filler? Well, good question. Of these, really my favorite real product is probably going to be a combination of a couple things. I actually really like to use like a hyaluronic acid filler deep to the bone. And then I also kind of blend it in with more like a collagen stimulating product. So I could do something like Bellafill, or we potentially could do like a dilute form of Sculptra or Radiesse. It just depends on how much volume loss there is and the collagen production that we need to do. So like my patient earlier today, she's trying to get ready for her daughter's wedding, and she was in her late 70s and just wanted something to improve her face. But I also wanted to give something that was going to be still be long lasting. So we did some Bellafill for her, as well as hyaluronic acid to give a little bit of lift, and then Bellafill, which is going to make the skin quality get better over time, which is awesome for a lot of patients, because over time it gets better. BB Gorge is saying, I'm getting lip filler for the first time tomorrow. What is your opinion on Versa filler? It's a good product too. I like it. I like Versa. It's nice because it's not too thick. It's relatively forgiving too. So that's what's good about it. I use that, or a lot more with like Restylane Kiss is usually what I usually use. I really like Restylane Kiss. I just don't love like the Juvederm line of products for the lips, or just in general for a lot of different things. I think they're just too reactive, and sometimes they can actually cause nodules and shift, especially in the lip area. How long does it take for hyperdiluted Radiesse to fill in indented scars? Well, Radiesse is a really slow process. Initially, you do see some volumization that occurs right there, but over time, it's really going to be stimulating your body's natural collagen, and that's going to be like 6 months, a year later or so. So really, really a lot slower than people may expect, actually. Yes, you'll see some volume right there, but it's really more about like that long-lasting collagen effect that you'll get. That's where it's actually really going to be really good. Can you get rid of smile lines without Botox? So smile lines are talking about the nasolabial fold. You never want to get rid of that completely. If you look at any little baby, just everybody has a little bit of a smile line. And you'll see if you're walking around my area, like Fashion Island, or if you go down in Beverly Hills and you're walking around over there, you'll see all these people with these big apples in the middle of their cheek. And they'll tell you that they never did cheek filler. But what ended up happening is someone put too much filler in their nasolabial fold, and then it shifted. So you gotta be really careful with that. I'm really conservative in the smile line area, and typically I do more like collagen stimulating products. One of the best ones is really going to be Bellafill for that area, but we could absolutely do hyaluronic acid filler as well. It's just you gotta be really, really conservative, and just really explain to patients that it's not going to be gone completely. It's just not going to be gone completely there. Is it okay to mix PRP and HA filler for under eye treatment? Yeah, that's okay. I mean, I'm not sure what the benefit would be per se, because I think that could end up being something that swells up a little bit too much, and you may not place that HA filler exactly the way you want to. And usually when I do hyaluronic acid filler, I actually typically go down to the bone for it, so it doesn't shift. And if you're doing it with PRP, you're probably doing it then more superficial. And now that hyaluronic acid filler could potentially shift, which is not going to be the best option. Please explain to us the new update about filler remaining and moving in the face. Sure. I mean, that's something I deal with so much because I do so much dissolving. A lot of patients come to me. I do a lot with scars and pigmentation and facial balancing, but I also do a lot with reversing filler for like pretty much a lot of patients in this entire area. And I use ultrasound to go directly at there. And I've known for a long, long time that filler has lasted a lot longer than people expect. There was a gentleman in Australia that we did a talk with years ago, and he was actually in the process of doing something where he was going to do an MRI study, and it actually ended up going viral. So it's really interesting because he found that on MRI you still see evidence of filler 12 years later. And that was something that we had seen really very clearly in our practice, that I had patients who had done filler like 10 years ago or so, and they saw that it was like swelling up, especially around the eye area. Like suddenly it would just be like up in the air when they're flying or something like that. They'll feel like it was more swollen. And people will just deny that there was any filler there. There's no way there's filler there. And sure enough, under ultrasound, you see filler. And you have to dissolve it. And when you dissolve it, it did get better. So it's like clear that, this was a problem. It was blocking lymphatic system. So there's a way to place filler, and it doesn't have to happen that way. And certain fillers, I think you could run into more problems. But it's certainly possible that if you are, somebody who has gotten filler done and it was more superficial, it's possible that it could shift, especially around the eye area. It's like an area that's very mobile, and it could shift like that. Yona is saying, is it normal for the pigment control cream to cause dryness and tightness? Can I apply it after my usual moisturizer? Yes, it could. It's totally normal, especially initially, to do that. And you absolutely could just use moisturizer. I mean, we try to exfoliate initially before we do the procedure, but it's okay. If you're just really too irritated, definitely try to moisturize as much as you want to. I'm okay with that. Feel free. I just want you to use it just to get yourself ready. Oh, hey, Vincent, how's it going, by the way? Good seeing you on. Parker McGuire saying, can you treat atrophic acne scars in the nose crease? Yes, I could tell you though, it's definitely going to take a lot longer though to really solve. It's a slower process though than other areas. Hala saying, I have scars from a dog attack, made an appointment to go see you. I can't wait. That's actually, I love doing traumatic scars. I'm sorry that happened to you, by the way. But they're actually really, really rewarding to me to treat. I like that. I actually like treating treating burn scars as well. Traumatic scars, like something where it's like knife injuries or dog attacks, things like that. It's like people will tell you the exact moment, that that everything changed in their life, and it's just like this constant reminder. So it's like, it's really nice. It's like in a way, it's like there's a psychological effect that you're sort of, you're improving people's mental livelihood, and which is really, really helpful, because it's like over time, they don't have to look at the mirror themselves and constantly get reminded of this like traumatic event, which is really helpful. Do you do exosomes, PRF under eye treatment? No, I don't. I don't do that. The FDA has actually come out and like just openly said not to do exosomes like injectables. So that's why I never touched it. It's, I've talked about it before, that I'm not like saying that the FDA is like the perfect thing or anything like that. But, when they do come out like strongly like that, I do pay attention. And it's like something I think that you have to really, really justify that you're going outside of the general norm and what they're saying. And it's really tough to do, because these companies that sell exosomes, they just don't show enough results. They don't show enough, the safety. I don't know if there's going to be problems down the line or anything like that. So yeah, the FDA has actually put a letter against the exosomes. So it's like, that's a big deal. They've done that. They've also done that against silicone injections. So it's like, you got to kind of pay attention whenever they do those things. And like, again, like I think that sometimes they're actually too slow with doing things, but if they are really talking against something, it's like kind of like I do pay, like it's really worth paying attention to it. It's like, right now we just saw that they got rid of red dye in food, which I put in the story earlier today, because that's awesome. It was like really like a decade too late probably that they did that. Like all food dyes should probably be banned at this point, but like, they haven't done that. But like the fact that they did do that now, it's like, okay, at least they did that, and you should probably pay attention to it and just kind of like, be really wary now of, red dye in your food, because it's like, it's a big deal for them to do that. Let's see here. Jennifer is saying Bellafill is permanent, but I feel it has junk in it. There is PMMA in it. If you opt really just for more like a calcium based product, that's like where Radiesse is probably going to be the most natural form for you. But it depends on, what you're trying to solve, and if you're okay with coming back and forth, things like that. That's really what all this is about. Bellafill is the longest lasting product that's out there. It's going to continuously stay to make sure you can make some collagen there. And some people make more collagen than other people. And a lot more people need, I would say, more collagen than they may expect. Adriana is saying, what is your opinion on using silicone for indented scars, especially for the nose? Again, that's what I was referring to, is that is another product that the FDA has actually come out against. So that's a big deal. It's pretty interesting. They've come out against using silicone injections. And so they've actually said that very, very clearly. You could look it up with the letter that they put out there against doing silicone injections. So it's like, you got to really justify this stuff then. And really, for my practice, we've actually dealt with patients who've gotten silicone injections before. And I've actually given it to my partner to try to help remove some of those. And it's really, really difficult, like during facelifts, things like that, to try to remove little silicone pieces. It's really, really tough to do that. And it's, and it's possible that it does cause more complications, because it is like this foreign body, and there's, it hasn't been studied enough to be safe. What's the treatment in an example photo? This is actually with dilute Radiesse. This is with some Bellafill. This is with a little bit of lip filler as well. How long after a Sculptra should one work out? Usually it's about 3 to 4 days, typically for most patients. It depends on your workouts. So, I don't know what kind of workouts you do. I do like kind of calisthenics, so it's like kind of okay for me, but like, I'm not sure. Some people are going like hardcore with the weightlifting. It's more like, that could potentially cause more swelling and potentially, prolong the healing process. How often would I have to get jaw injections as a male to keep a natural look? Good question. Initially we'll try to use more like hyaluronic acid fillers. Typically will start with those, which aren't going to last too long. They'll usually last you up to about a year. But we could top it off with like more permanent ones like Bellafill, which will last a lot longer. Like that 20% would stay there. And then you could also do like this exact type of product, which is a calcium-based product. You could use that. You could do Sculptra as well. Those are all potential options there. So it sort of depends on how deficient your jaw is in the first place. But if we're using more permanent products like Bellafill, we could kind of build onto it and just keep on putting a little bit of that in there until it gets to the level we need to, and you don't need to touch it again really much, which is really nice. Once it's there and it's at a pretty good level, you don't have to touch it too much then, which is really, really useful. Especially for someone like me, I don't have time to go back and forth. I have all these devices around me, things like that. It's like really hard for me to do any like procedures, like just with my busy time. And so it's like, I'd rather do things that are like really long lasting and stuff like that. So it's like, I love Bellafill because it's long lasting, but like, of course I have other options. If you don't want like more permanent things, if you don't want to do something that's made out of cow collagen. So Bellafill is made out of cow collagen. 80% of it's bovine collagen, and then 20% of it's something called PMMA. And basically, as that bovine collagen is reabsorbed by your body learns how to make collagen around that PMMA. So you always have that 20% of PMMA, and then your body learns how to make more collagen around it, which is really helpful. It's really nice, especially for scars, but also for like facial balancing for like people like myself who like, I don't really have any fat really to give. So like little bits of volume shifts and things like that for me, it's like a big deal. Like I get really hollowed out really fast. So it's like nice that I always have a little bit of support there with something like Bellafill, which is like useful for me, because otherwise, like when I was like 7 years ago or so, when my wife was pregnant, I was like really busy with work and things like that, and I was just like getting really hollowed out, really chiseled out, and I was like, I wasn't loving it. I just looked like I was like really aged suddenly. And now it's like I'm back to where I was kind of like, close to like my late 20s or early 30s. But like, a few years ago, like it was like I just like got really hollowed out and really like aged. And it's like interesting because people say, well, don't do fillers, don't touch it. I kind of was in that same category, actually. I was thinking like, I'm from Chicago, and it was like really natural look and things like that. And then I came over here and I was like, what on earth? You like walk around, Fashion Island, you walk around Beverly Hills, and I was thinking like, there's no way I'm going to be able to do fillers over here, because like if this is the look that people want, I never want to do it like that. I never want to like make it like this look. And so it was like kind of like, a shock to me, because it really was. It was like, from Chicago mindset, like where it's just like really like natural, like you just don't like, nobody said, people at that time especially were like saying they never did anything and stuff like that. And so I was looking at everybody, and I was walking around, and I'm like the people at the checkout aisle and things like that, they had these big apples in the middle of their cheek and stuff. And I was like, this is not my look and my style at all. But like once I like realized that like, okay, actually there's a lot more people over here that want like this natural look. They want that. They want to just look like they're like just, aging gracefully and things like that. And I was like, this is more my style, and we could do that, and we could achieve that like over and over again. What do I think of ProCell microchanneling? It depends on what you're trying to do with that. I mean, I don't think it's going to help too much. But if you do, for more like just mild regeneration, it's probably okay. But like ProCell is expensive. I would do just with like PRP. Honestly, I don't think you have to do much more with that though. PRP, a little bit of hyaluronic acid. That's pretty much all you need to do. Where was I at though? Why is Bellafill better than silicone? So Bellafill is, the only FDA approved product. It's the only FDA approved one, and for acne scars, that's something. And silicone, there's so many more complications that I've run into, so many more complications. And the thing is, interesting enough, in this area, like I do see a lot of complications of people that do like Bellafill, things like that. And here and there, I would see some complications with Bellafill, like from like 10 years ago. So somebody maybe put too much in there, and I kind of know the person that did that, and I've seen the way they do it, and I know that they have a heavy hand. It's way more common, like I would say, with like something like silicones. Like even if the person may have done something okay with it, it's like I think they, you could run into a lot more complications with it. And I think that's sort of what the FDA has realized as well, is that, and that's why they spoke against it, because you do get more reactions with it and things like that. Whereas like granuloma formation, all those things, if you keep it really clean on there, really low likelihood of anything like that. Was my practice affected by the wildfires at all? It's not that it was like directly affected. We're pretty far away in Orange County. A lot of patients had to shift their appointments. A lot of people had to do that, and a lot of people were just suffering. Like some patients actually, their homes were either threatened, and some patients actually did lose their homes, or potentially they don't even know if they lost their homes because it was in like Malibu or in that area. They haven't gone up there yet after they left. And other patients, they're taking on family and things like that. And it turns out like the government's only giving them like $760 or something like that. I'm not sure what the game plan is with that, but apparently they're only giving like $700, and they're like putting a bunch of conditions on it. People are very upset. People, it's like rightfully so. And we have like inmates that are doing all this. And do you see like the photos are like a bunch of juvenile inmates that they're using for these firefighting things? It's just like a juvenile, like these kids. And they're giving them only like $5 a day, $5 to $10 a day. It's just unbelievable to me. We all know about this stuff now at this point, but like, it's just, you see it firsthand. And it's like gets closer and closer to you. It's like, and it's crazy. But yes, I'm not directly affected by it. But honestly, anytime I see this kind of suffering like this and like this kind of like ridiculousness, it's like it really does like just like make you upset with a lot of stuff there. It's like I don't know how we're okay with that kind of system. It just doesn't make sense to me. What happens if too much Bellafill is put in? Can it be taken out? Good question. Actually, for the first 4 days or so, it is possible to kind of massage it a bit though if you need to. So it is possible. So especially in like the shower, interestingly enough. So I could actually, if that ever happened to you, I'll talk it through and help you out with that. But I had somebody who reached out to me on like Instagram or something like that a little while ago, and they injected somewhere before with something that I was saying, like, just as like not exactly medical advice, but just something to consider. You could do it, and it turned out it actually worked out actually for them. So interestingly enough, it's an idea that you could consider. Let's see, where was I at there? What's the before and after of this photo? That's actually nice. That's a nice compliment that you can't tell the before and after. Actually, that's really, really good. Hopefully, if you pay attention to it again, you could be able to see which one's before and which one after there. What's my opinion of skin lightening in the underarms? Well, it's great. You could do it for the right patient. The best thing to do is start with something like Eucerin's anti-pigment cream. It's a really easy, gentle cream. You could do that, and then we could do it with the Pico laser, and that works out really well. Parker McGuire is saying, can atrophic scars in the nose crease heal as well as other places, filling in to where they don't reflect light as harshly, even though structure needs to rebuild? Good question, Parker. I have to see it. It's a tough spot, though, to be honest with you. I do want to see, and sometimes I may just do a little bit of Bellafill there. Alex Morgan, how's it going, Alex? Doc, I plan to visit you for treatment in the next 6 to 8 months. Should I wait and do nothing till then, or consider treatments locally like Bellafill for volume loss or erbium lasers in the meantime? I don't mind like you doing erbium lasers. Probably would not have you do Bellafill though, to be honest with you. I'm not sure who you're going to. I did a consultation today and I did feel bad because the patient was waiting. I guess he couldn't see me earlier, and then he did get a treatment elsewhere. And it just was obvious that they didn't do a proper job with like undermining with subcision and things like that. And so the filler like kind of was on the outside. It was a bit of a donut effect. It's going to be like, we'll have to fix it. We could be able to fix that down the line, but I hope like we don't have to go down that route for someone like you. So just wait for something like that, especially like a permanent filler like Bellafill. Consider it. Erbium laser is okay. If you want to do that before with me, that's okay. PK Farnsworth is saying, for face, how do you choose between Radiesse or Sculptra for acne scars and mid-face volume loss? So if there's a lot of volume loss, I do like Sculptra. I like it a lot. It does give you a little bit more volume, but Radiesse is really good, especially for more of that skin tightening effect. And then again, it will give you a little bit of volume, but it'll give you a little bit more of that skin tightening effect. I usually use more of a dilute form of Radiesse. I don't do just like the pure form of Radiesse typically. How do you treat hypertrophic scars on the nose? Good question. So we're talking about probably as more like papular scars. Usually I use a CO2 laser to burn it down. And then a lot of times we'll have to put a little bit of steroid injections as well in there, and then silicone tape afterwards. And silicone tape will help keep it flat. So that's usually what I end up doing. Jennifer, LA Makeup is saying LA is heavy right now. Hopefully, Jennifer, your house is okay. Everything is okay with you. But yeah, it is heavy. It's a crazy situation. Joey's saying that it's $24 a day. I don't know. I've heard it was like $5 to $10. I'm not sure what the exact price is that they're paying some of these inmate firefighters, but it's terrible. And they're risking their lives. I don't know how many people are like, and who knows what they're doing. I saw like there was a photo of them giving food out to a bunch of people, but like there were the inmates and stuff like that. And I don't know if they're giving them masks or anything, because like right now they haven't even everybody actually, just so you know, everybody in LA should be wearing masks. I hope you guys are wearing masks. I try to get like K95s or N95s ideally. Really strongly consider doing that, because it's like you may not notice it right now, but down the line you could end up getting lung issues. Something that I saw before in the past was something like pulmonary fibrosis that could occur after burns or burn inhalation. So just something to pay attention to. They haven't even announced it. I don't know why they haven't told anybody that, but like in our area, Orange County, it's been fine. But like in the closer to the fire area, really strongly consider wearing a mask while you're walking around. And just because they didn't pass out masks or didn't do anything like that, just you heard it from me. Just like pay attention to your own health and your own safety, and like consider that really strongly. I know there was like a big push against masks before, like for whatever reason, but like just like at least at this point, because of these fires, try to do that and consider that. Sculptra at 21 for hollowness. Yeah, if there is really true hollowness, it's fine. We could do Sculptra at whatever age it is. If it is that there's some volume loss or hollowness, it's okay. What to do with oily and sensitive skin? One of the easiest things to do is just 10% azelaic acid. It works out really well. You can just do it over the counter. It's okay because even for sensitive skin, it's not going to be irritated too much. Just 10% azelaic acid. It'll take some time. It'll take like three months or so, but it should be able to help you out there. Sonia is saying the air is bad. We've been running air purifiers all day. And that's awesome that you are doing that. It was really good. And just think about now, all the people out there, just think about how many people don't have air purifiers. And I heard, I'm not sure the exact number, but there's supposedly 70,000 people without homes. They're homeless in LA. So just imagine what they're up to. Like, I don't even know. It's unbelievable, really. And I don't, like, the scale of this is like, it's enormous. And it's essentially because of years and years of neglect. And now we're like at the situation where it's like just at our doorstep, we just have an enormous catastrophe, and they're just totally ill prepared. And they want to do like Olympics over here. That's what they want to do, Olympics over here. There's no there's no public transportation system. I don't understand what their goal is really. Like, they why not pay attention to like figuring out how to solve the homeless population before trying to put millions of dollars for stadiums for Olympic situation? I don't understand. Sony's saying my parents are still without power, but still have their home. Thank God. Fortunately, that's good. You should consider opening up a clinic in Pasadena or La Canada. I like where I'm at right now because we could keep it really, really high standard. So that's where I'm going to stay at right now. I love my area. It's also super close to the airport, but I appreciate you. We do have patients from all over, and I'll be happy to help you out when you come down one day. But I have to keep like a certain level every single time, and I can really only do that with my team right now. What do you recommend for under eye hollowness? Well, if it is true under eye hollowness, you may just need to do a filler. There's a way to do it. You can do it safely and properly. There's still a way to do it. You usually want to do like in the mid cheek. You want to support that area first, and then do a little bit underneath the eye there, the tear trough area. What are some pretty normal everyday advice you could recommend that you couldn't go without? Well, the easiest thing to do is start a retinoid. Easiest thing in the world. Start a retinoid. That's like retinoid, sunblock. Easiest two things you could do. It's like so easy because in my day we didn't have like a retinoid that was like a over the counter like different, and there you have it. Like just grab different over the counter at Target and use a moisturizer like Vanity Cream and use sunblock, and that's like all you need to do in life, and you'll be like pretty good with that, just like that. And that's like 3 to 6 months out, you're gonna have like better skin, which is really cool. That's like a really easy way to get better skin. And like if you like are in like Mexico and like you see like tretinoin there, like that's pretty, it's like at the pharmacy over there, you're like, why not? It's like it's sitting there. It's like there's a prescription grade tretinoin there, usually like 0.025. I'm not saying like you should get it, but like I'm just saying it's there, and like it's like pretty good. Thoughts on hydrofacial? It's okay. It's like a light thing. It's just like, I think it's okay if you want to do it. At least it's not like aggressive and exfoliating type of thing. Is hyaluronic acid liquid good for the skin? Yeah, it's good. What you could do with hyaluronic acid was something like a little pro tip. You could put a little hyaluronic acid and then put silicone tape afterwards. And it's actually awesome. Your skin's going to love it. Just trust me on that. That's actually a really great little slam dunk way of actually hydrating your skin. Put little drops of hyaluronic acid, wait a little bit, like maybe like 5-10 minutes, and then put silicone tape on that area. It actually works really, really well. And do the silicone tape actually, like it actually does help with like just wrinkles and just hopefully help out with actually softening up your skin. Do that. You'll see like after a couple of weeks, your skin's going to be really cool too. So just some little pro tips right there for you guys. All right, I will kind of wrap up for tonight unless there's anything else pressing. I think I hit most of the big ones. I saw some other ones, but I'll try to get those for tomorrow too. And feel free to help me out. Silicone tape, I don't know about the one from CVS. We have one on our website at drqazi.com. You can take a look at that. It's not like as much. It's like, I think it's like $12, something like that. But that one actually works really well. That's what I use actually. It works really, really well. So consider